about health psychology research, which gonna be a set of analytic statements that can explain a set of phenomena. There are gonna be so many advantages for that. I guess you all know about this. For example, if we would have a research study or if we would have like some sort of theories, we can just do intervention. We can just understand what's gonna cause a specific phenomena. So we can just test that phenomena and we can just generate some specific prediction and we can just address any sort of errors. So there are going to be different ways of researching. The most important one, and I guess the most familiar ones for you, going to be experiments. Experiments going to be two or more different conditions. Like it should be at least two conditions, and we have to assign randomly. This word is just very important. We have to assign randomly people to different groups, at least two. One group gonna be control, one group gonna be experiment group, and we're gonna just measure a specific independent variable or factors on people. I'm gonna give you one example because I know that it might be a bit confusing. Um, I guess you remember Dory. If you watched Nemo, you would know that Dory had short-term memory. I mean, I guess she had like some sort of memory loss or something. So just imagine our hypothesis would be more sleep gonna improve memory recall. So again, we're gonna have at least two groups of people. We're gonna assign randomly, remember that, 25 students to control group. So control group gonna have normal hours of sleep. Then we're gonna assign 25 students to experimental group, which we're gonna ask them, like we literally gonna do an intervention. We're gonna ask them to sleep more. For example, we're gonna ask them, hey, you have to sleep like 10 hours per night instead of just 8 hours. It's gonna have duration, like all of experimental design, they're gonna have a specific duration. This is gonna be 1 week. And after 1 week, we're gonna test participants for their memory recall. For example, we're gonna give them 20 words, like we're gonna give them an item list that's gonna have like, let's say 20 words. And we're gonna ask them to just memorize that words in 5 minutes. And after 5 minutes, we're going to ask them to recall. So this way we can understand which group could remember better. And we're going to see if our expected results or prediction going to be true or it has to be rejected. There's going to be another way of doing research, randomized clinical trials, which we're going to call that RCT. It is basically all about evaluating effectiveness of different treatments or intervention over time. For example, let's say you discovered a drug for depression. The drug's name is Armitage. So you're going to actually compare Armitage, like the new drug, compared to a placebo. For example, let's say again, you're gonna have two groups, same as the experimental design. One group gonna have the drug that you discovered, another one gonna be a placebo, and you're gonna just see which one gonna impact, for example, severe depression. Okay, so this is like the only difference. This time you're gonna discover something. And the last one is EBM or evidence-based medicine. It is basically an intervention, and you're gonna, like, as a doctor or as a provider, you're gonna do research this time. Like, literally, for example, you're gonna have a patient and you're gonna just research all of the drugs out there to just see which one gonna be better for your specific patient. I'm going to give you an example here. For example, it's going to have at least like 7 different states, if not more. First of all, you're going to see what's going to be your research question. For example, you're going to have a specific patient. They're going to have like diabetes, and you're going to see, for example, if medication A versus medication B, which one going to be more effective to just help them. Then you're going to search for evidence. You're gonna just search all the drugs out there, all of the important one, or even like those who are not very important. And after that, you're gonna understand in step 3, you're gonna understand which one gonna be better, and you're gonna go by medication A. Okay, so after choosing medication A, you're gonna apply the evidence. You're gonna check patient's medical history, preferences, like lifestyle, all of that. And right after that, you're gonna talk to your patient and you're gonna just ask them about their values, their preferences. Probably, I mean, I would say most of the time, patients they are just very flexible about what the doctor gonna suggest. But there are gonna be some patients they would say that, hey, my lifestyle is different, or for example, I'm really sensitive about any sort of medication, so I would prefer like less side effect. In those cases, you have to make a decision. If you feel like, for example, medication A that you chose before might bring a lot of side effects for your patient, you have to respect your patient's opinion and go for medication B. Okay? So you're gonna shift even though you know that medication A might be better, but again, you should ask in this method, you should ask from your patient about their values and preferences. And lastly, you're gonna monitor your patient to just see how medication B gonna actually help them with their diabetes, and if it is necessary, you have to do adjustments.